Protection, and Dr. Lau Kai-hin, Chief Manager from Hospital Authority. Dr. Choi, please. Good afternoon, everyone. I'd like to give you an update of the declaration system for individual tested positive for COVID-19 using RAT. So I will first give you an overview of the situation before Dr. Zheng will brief you on the latest situation of cases. Starting from the 7th of March, we've launched this declaration system, which is online for individuals tested positive for COVID-19 using RAT to report the cases. We advised those tested positive between the 26th of February and the 5th of March to refrain from making reports too quickly, because we do allow a certain period for people to do so. So the deadline is the 14th of March, midnight. Let me show you some analysis of data reported to us. Now, there are two types of reported cases. The bars in green are results of PCR tests. The orange bars are cases tested positive using RAT. From the 26th of February to the 8th of March, we have received 184,390 cases tested positive using RAT. They're required to tell us the date of their test. So we then compile the chart according to the dates provided. This is very useful for data analysis. We know that many people out there are using RAT, and figures from both systems added together will give us an overall picture of daily number of infections. So from the 17th of February onwards, we saw an upward trend, and the peak was on the 2nd and the 3rd of March. Back then, the daily number of infections were over 70,000. And then the cases started to go down from the peak in the past 7 days. On average, we had about 30,000 cases. The latest figures are half of them were tested positive using PCR, the other half using RAT. So in the past 7 days, we had close to 30,000 cases. However, the situation is somehow steady. Starting from the 10th of March, the declaration system has been receiving a steady number of cases. Usually, members of the public tested positive using RAT would report on the same day, and then an SMS would be sent to the individual, and a link will be provided for uploading of an ID document and the RAT positive image, and then the follow-up action would follow. And so the number of an isolation order would be easier. The number has been more or less stable. Dr. Zhang. Yes, yesterday, the number of PCR positive cases numbered 14,454. By using RAT, we had 14,818, excluding the 180,390 cases reported by Dr. Choi. The two systems add up to give 29,272 cases. Whether we are talking about PCR positive cases or RAT positive cases, the total number of cases in the fifth round or fifth wave was 962,581 cases. 649,454 cases were tested positive using PCR. 313,127 cases using RAT. Among the 14,554 cases, PCR positive cases, 2,906 cases were tested by HA, 1,623 by Public Health Laboratory of Department of Health, and 9,925 by private laboratories. Among the 1,623 cases, we did genome sequencing. There was no case positive to L452R. 189 cases could not find L452R, so they were suspected Omicron cases. For the remaining 4,000 odd cases, the viral load was either too low or results pending. We had 11 imported cases. 2 arrived from Singapore on the 15th of March on SQ894 and 5 on EK384, arriving on the 15th of March, 2 on GA876 on the 6th of March, and 1 from TG600 from Thailand, 1 also from Singapore, arriving on the 12th of March, also on SQ894. For the death toll, another 278 deaths were reported. 217 passed away yesterday. 61 were cases from previously. Non-HA death cases grew by 1. A 53-year-old man with renal failure. So every 2 to 3 days, he had to attend renal dialysis. He passed away at home. There are a total of 15 cases of death not in HA hospitals. In the 5th wave, we have a total of 6,434 deaths. Analyzing the death cases, 1,791 were female, 2,828 male, aged from between 11 months and 102 years old. 58% of them were care home cases. About 11% of them has had 2 doses of vaccines. Close to 90% of them were not completely vaccinated. About 87% of them had chronic illnesses. The overall mortality rate is about 0.48%. Among the death cases, over 70% of them were over 80 years old. The death rate in this age group is about 9.8%. But for those who are vaccinated, the overall death rate is lower, is about 0.09%. Those not completely vaccinated, 1.8%, a 20 times difference. For those over 80 years old, there is also a difference between those vaccinated and not fully vaccinated. 3.4% for completely vaccinated and 12.15% for the unvaccinated. The Public Health Laboratory has done genome analysis of the death cases. And when there is sufficient viral load, we did some analysis. Among the 188 cases where genetic analysis were done, 21 or about 11% of them carried 4 L452R, possibly Delta cases. So the death rate for Delta cases is higher. For care homes, we received 11 reports from care homes, 3 from RCHDs and 8 from RCHEs. A total of 104 residents and 47 staff members were infected. In the past 2 weeks, there was a total of 122 residential camps for the disabled and 279 RCHEs affected, either residents or staff members infected. 12,002 residents were affected, or about 83% or 13%, and 2,139 staff members, or about 70% of the population. That's all from me today.
Can Dr. Lau brief us on the situation at the AHA, please? Right now, 10,368 students are staying in public hospitals, the North Lantau Hospital, Hong Kong Infectious Control Center, the Asia Infection Control Center, and the Asia World Expo Community Treatment Facility. Last night, as of last night, 81 were in critical condition, 138 were in serious condition. Right now, 119 patients in critical condition are staying in ICUs. As of midnight, over the past 24 hours, 217 patients who tested positive to COVID-19 passed away, including 124 males and 39 females aged 35 to 105 years old. Now, I'd like to offer an analysis of the 217 patients who passed away. 125 patients came from residential care homes. 151 patients did not have any vaccination record. Among the vaccinated, 41 received 1 dose, 21 received 2 doses, 4 received 3 doses. 198 patients who passed away were aged 65 and above. I'd like to highlight 7 of these patients. A 35 patient carried hepatitis B, and he had liver cancer, and the cancer had spread, so he had chronic illnesses and he was rather weak. Another patient experienced bleeding in the brain, and he had to stay in attention and care homes, and he had to be in bed, and this is a 40-year-old patient who passed away. Another 42-year-old patient had colon cancer, and the cancer had spread to different parts of the body. A 44-year-old patient was admitted for other reasons. There was brain hemorrhage, and subsequently the patient tested positive to COVID. A 55-year-old patient had an inborn neurological tumor. The patient lived in attention and care homes, and the patient had to be intubated. A 57-year-old had a chromosome disorder. He lived in a home for the disabled, and the patient had epilepsy and mental disorder. And a 58-year-old patient had nasopharyngeal cancer. The patient was taking steroids to treat the after effects of the cancer, and as such, his health could be affected by steroids, and due to a backlog in data. And from 8th to 14th of March, a total of 61 patients passed away, including 34 males and 27 females aged 42 to 105. I'd like to share an announcement. This morning, 2 of our patients were sent to the North Lantau Hospital A&E ward, and they subsequently passed away. These 2 patients were 92 and 90-year-old females. At about 8 a.m. today, they were transferred from hall number 7 of Asia World Expo. They were transferred to North Dental Hospital. They were in serious condition upon admission, and upon first day they passed away at 9:09 and 9:16 a.m. respectively. They both tested positive to COVID-19. They had chronic illnesses and neither had any vaccination record. A 72-year-old male patient was staying in Hall 2 of Asia World Expo, which was an isolation center managed by the SWD. He was taken to the North Dental Hospital. He tested positive to COVID. He is currently in stable condition. Over the past day, 1,058 patients recovered and were discharged. About 40 patients tested positive upon admission screening. About 40 patients in the same wards were classified as close contacts for staff members. 18,118 staff members tested positive to COVID-19. 8,629 have returned to work. I'd like to deliver a report on the mainland medical support team. The medical support team continue to familiarize themselves with the operation of the Asia World Expo Community Treatment Facility, and they would begin work very soon. Together with the HA staff, they would provide care to patients. Members of the mainland medical support team are preparing to begin clinical work at the treatment facility. The nature of work would be the same as local medical staff, including doing the ward rounds, providing treatment for patients, and administering first aid if necessary. The HA's clinical system has introduced a Chinese interface, and members of the mainland medical support team could enter information into the system without having to go through local healthcare staff or require translation support. Even though the systems used by the local medical staff and mainland medical support team might be different, but we share a common goal of supporting the patients and providing treatment to patients. Once again, the HA would like to thank the mainland authorities for deploying a medical support team to help tackle the epidemic in Hong Kong. Apart from offering manpower support, this can reinforce our capability to accept patients in public hospitals. And together with the FHB, Chinese proprietary medicine will be distributed, including the Qingheng medicine, and these were recommended by the treatment plan for Chinese proprietary medicine. And at the Queens Hill Community Treatment Facility, Liking Estate, isolation facility, Xingyi isolation facility, 22 quarantine hotels, and the Chinese medicine training centers, these medications would be distributed. So far, about 40,000 boxes have been distributed. The HA will continue to support the government's arrangements at different isolation facilities and continue to distribute the proprietary Chinese medicine at the different facilities. I'd like to remind the public to consider their own physical conditions before using proprietary Chinese medicine. So before taking the Chinese medicine, they can consult Chinese medicine practitioners or refer to the instructions provided by the medicine. The HA's Chinese medicine unit provides a hotline 1-833-4511, and the hotline will operate from 9 to 7 Monday to Sunday, including public holidays and the Chinese medicine practitioners can answer questions from the public.
Questions. Please identify the organization you represent before you ask a question. The gentleman at the back. Good afternoon. I'm from Hong Kong 01. I've got a few questions. The Department of Health just announced the death toll so far. Over 4,800 people have passed away because of COVID-19 in Hong Kong. In the mainland, the death toll as at yesterday was only 4,600. In comparison, our death toll has already exceeded that of the mainland. I'd like to ask the Department of Health your view on such data. And it's reported that this morning at AWE, 3 elderly persons fainted and 2 have passed away. So you told us about the 2. I'd like to know when were they sent to the hospital, and did they have any chronic illnesses, or what was their condition? And for the remaining elderly person who has fainted, what is the condition now? You told us that more than 40,000 packs of Chinese proprietary medicine have been distributed. So far, has the HA received any reports of discomfort or adverse effects after taking the medicine? I'll give the floor to Dr. Lau to report on the distribution of Chinese proprietary medicine and individual cases. Now, we try to report to you the death toll on a daily basis as far as possible. Now, if the HA can elaborate on a particular case, it would do so, such as some background information. For instance, for some of the cases, they were admitted because of brain hemorrhage, and some were due to renal failure, etc. They will give you details to facilitate your understanding. But if we just compare, death tolls is a bit difficult because we have this policy in our hospital. Anyone admitted to a hospital will be tested for COVID-19. So did a case pass away because of COVID-19 or other conditions, or due to some underlying disease? When we report the cases to you, it may not yet be entirely clear. So our medical experts and the HA will do an analysis afterwards to see whether there are other risk factors leading to a high death rate for COVID patients. We see a higher death toll in this wave of outbreak because in this wave, the elderly persons, especially those unvaccinated, are mostly affected, and they account for the largest number of deaths. So for senior citizens, unvaccinated, they are more vulnerable to complications and even result in death after infection. I think this is widely known. So in the 5th wave of outbreak, we see a higher number of deaths in previous waves. And the number of patients in the 5th wave is also higher. So when the denominator is high, the numerator is also high. So we do care for the high death rate, and we are looking for ways to lower the number of deaths. So different departments are expediting the vaccination of residents in elderly care homes. And we're trying to arrange for high-risk persons to medical institutions to give them speedy treatment. HA is now using 2 new Western drugs. This will greatly help high-risk persons. They should help a lot in lowering complications and deaths among high-risk patients. Later on, we will give you an account and see whether there is a marked improvement in terms of serious cases and number of deaths. Dr. Lau, thank you. First, the death figures, perhaps I got it wrong. We have 217 patients tested positive passed away in the past 24 hours. There were 124 male and 93 female, aged in between 43 and 105, of 42 and 105. In AWE, an isolation facility managed by the SWD. They were sent to the North Atlanta Hospital A&E department at around 8 in the morning. Unfortunately, the two passed away at 9:09 a.m. and 9:16 a.m. respectively. Checking their records, well, one was 92 years old and one was 90, and they had chronic illnesses. Third, there was no vaccination record for them. For the 22-year-old man, he was in an isolation facility in Asia World Expo, Hall number 2, managed by SWD. He was sent to the North Atlanta Hospital A&E department, and he's now in stable condition. So far, we have not received any reports of special conditions after taking the Chinese proprietary medicine. But we do suggest that before you take a certain medicine, you should take into account your own physical condition and your own condition. So if you have a doubt, please consult Chinese medical practitioners that you know, or you can also call this hotline we just announced, 1-834-511, available from 9 a.m. to 7 p.m. throughout the week. This lady at the back, I'm from Now TV. I have a question about the declaration system for RAT. Some on sampling with PCR were found negative. Do you think that these were false reports? Will there be any penalty? And if in the unfortunate event that there is a medical incident or complaint against medical mainland staff, what are the procedures? And for the shortage of coffins, I'd like to know whether the accumulation of corpses has deteriorated again. Do you have enough refrigerating container to store them? Now, there are about 1,000 or so beds for receiving COVID patients. Are you satisfied with that? Private hospitals have yet to start admitting COVID patients. Have you ascertained from them the reasons why? Now, we have found some negative cases among cases reported through the declaration system and our follow-up work. And perhaps Dr. Lau can talk about the situation with A&E department. Now, I hope you understand that because of the epidemic, we are grateful to many organizations for helping Hong Kong mainland. There are mainland medical teams and experts in Hong Kong to help us. Dr. Lau can explain to you the interface required between the two parties. But I hope we should all be grateful because the medical healthcare teams are here the mainland medical teams are here to help us. Now, we should not focus on complaints and complaint channels. I think the most important thing is to provide treatment to patients. And of course, the HA has got channels for patients to reflect their views, and these channels are still valid. As for the declaration system for RAT positive cases, we do random sampling of some cases report to us. Very expeditiously, we will ask our partnering contractors to arrive at the homes of these cases, and we'll take a nasal swab for a PCR test. If the result is positive, that's reasonable. If it is negative, we will have to investigate. We will consider whether the RAT positive result was wrong. If so, the reasons for that.
即係話咧，我哋
So it could be sometime before we make a home visit. We currently work closely with our contractors. Once we receive a positive RAT report, basically the contractor can make a home visit on the next day to collect nasal swab samples. For if the result is negative, they might be sent to quarantine facilities for further investigation and tests, for example, to carry out another PCR test or deep throat saliva analysis. We saw that in some cases, the pictures uploaded had two faint lines. If you have ever did an RAT, if there are two clear lines, then it's a clear positive result. If both lines are unclear, we would recommend another test. We saw some cases in which both lines were blurry, and those were actually not positive cases. And in that case, we would terminate their isolation orders. There were some cases in which the relevant persons willfully provided false information. If that's the case, we would carry out further investigation. And we might share any information on any such cases later. I invite Dr. Lau to tell us about the situation at hospitals. Like Dr. Choi said, we would like to thank the mainland medical teams for coming to Hong Kong to help take care of our patients. They had to leave their families to help attend to patients in Hong Kong. So we like to express our gratitude towards the team. Some people did lodge complaints in hospitals. There's a patient liaison team, and they receive more letters of appreciation than complaints. But very often, we would not talk about the commendations, but from our statistics, many more patients commended our work than those who lodge complaints. The mainland medical support team members are honorary employees, and this is not something new at the HA. University professors or prominent doctors, many of them are our honorary employees, and they have the same status as the HA's employees. And if there are issues, the HA would assume final responsibility. All the comments, commendations, and complaints would follow the existing mechanism on HA staff. Altogether, private hospitals are providing 1,000 beds to receive HA patients. In the fifth wave of the epidemic, we are facing unprecedented pressure, so I'd like to thank the support offered by private hospitals in receiving our patients. Like we said earlier, collaboration programs with private hospitals were launched, and we referred a large number of patients, including recovering patients, those who require rehabilitation, those who awaiting surgery or cancer patients, etc. Many of these patients are non-COVID patients. Well, some COVID patients have been transferred to hospitals such as the COHK Medical Center. The Li Ka-shing Foundation also offered donations through different projects, and some patients from public hospitals were referred to private hospitals for different surgeries, such as colorectal cancer surgery, etc. And we would like to thank the support offered by private hospitals. The speaker is not coming through the microphone. Comments, commendations, and complaints, they would be dealt with by the patient liaison units, and the mechanism would be completely in line with the current HA systems. For patients who pass away, at times their bodies required storage, and death certificates had to be issued, and support was needed with cremation, etc. And as we said before, when the HA or Department of Health has to store extra bodies, extra equipment must be installed. And in terms of streamlining certain processes, our office has sped up work on applying for cremation. And finally, we have to work with the funeral services industry, and family members might need to hold different ceremonies and to proceed with cremation, etc. So in terms of processing the paperwork, and in terms of the waiting time for cremation, we are constantly speeding up the work. So in terms of medical supplies that arrive in Hong Kong, we would monitor the situation. Due to the pandemic on the mainland, there could be logistical challenges, and we are doing our best to smooth out the process. The storage container outside Fushan Mortuary has been reinforced, and it can handle about 2,000 bodies at the moment. The reporter on the front row, please. I'm from Cable TV. For the AWE Community Isolation Facility, 2 elderly people who tested positive passed away this morning. What were their conditions the day before? Why did they not survive? Was it due to a lack of care since there were too many patients this morning? Mrs. Lam said that uninfected residents in residential care homes with an outbreak would be transferred to other facilities for isolation. Could it be possible that these were undetected patients? If transferring them to new homes lead to a new outbreak, what would happen? Dr. Lau said the mainland medical support team staff could use the Chinese interface, and they do not need translation support from the local staff. So would there be any repercussions on the assessment on patient's situation or conditions? How many HA non-COVID patients have been transferred or referred to private hospitals, and how many will be transferred? This morning, the chairman of the Association of Private Hospitals has said that the number of hospitalizations went down by 1/3. So would the HA's non-emergency services for non-COVID patients be affected?
I'll first talk about the arrangement of reverse isolation, and Dr. Lau will take the remaining 3 questions. Now, reverse isolation is very similar to quarantine in the past. Those who are not affected, not infected, should be isolated, and we can closely monitor their situation. Of course, we will monitor whether they've already exposed to the virus and become a positive case, because once an elder becomes a positive case, he'll have to be removed. Luckily, we're now using RAT more commonly. So if in a care home RAT is being done every day, you will very easily detect positive cases. Then it's possible to strengthen infection control measures or isolate the positive case very quickly. So RAT is a great help nowadays. Dr. Lau, this morning, three cases were transferred from Asia World Expo to Northlanta Hospital. They were being cared and treated in isolation centers. They are operated by SWD, so we do not have details of their condition with us now. Now, from various channels, we know that mainland experts in Hong Kong or the visiting mainland medical health expert in Hong Kong, many of them know English, and of course, they use Chinese more often in their daily communication. So we've added a Chinese interface in our computer system so that in guidelines, etc., are now in Chinese to facilitate them, and they can also input Chinese into our system. And even if they have done so, many doctors in Hong Kong do know Chinese, and we do not just rely on language or written records for communication. We meet on a daily basis on the conditions and treatment of patients and to find out the best treatment. Such communication can greatly help us to understand the different methods used by experts to give the best treatment to our patients. As at the 15th of March, we have about 170 HA patients using private hospital beds. Of course, more and more private hospital beds are available, and hence we can transfer more patients to private hospitals for care. Now, because we have more and more COVID patients, as we all know, half of the beds in our hospitals have been converted to receive COVID patients. We don't want patients to wait for too long. For instance, cancer patients and heart conditions, we can then make use of private hospital beds. Because public hospitals are so busy, we will concentrate our efforts on COVID patients, and we will refer these patients to private hospitals so we can reserve our resources to take care of COVID patients. Of course, if private hospitals can provide more beds for public hospital patients, then we can then make available more beds and manpower to admit COVID patients. Next, I'm from Oriental Daily. I've got 3 questions. First, the oral drugs for COVID. Some experts encourage patients to tell doctors Western medicine they are taking because, for instance, Pfizer may not go down well with other medication. So will you give guidelines to doctors, contraindications for prescription of Pfizer? AWE is mainly for elders that require more care. So what are the criteria in deciding whether elderly patients should be treated at Asia World Expo or hospitals? As for the anti-epidemic kits, there are complaints that using oximeters provided by the government, their oxygen level is lower. But if they use oximeters they procure themselves, then the oxygen level is normal. So which standard should prevail, the government's oximeter or residents or people's own oximeters? And what are the specifications for the oximeters? Now, first, the anti-epidemic kit. I think many members of the public have encountered similar difficulties when they measure their blood pressure. They will say that different um, readings or different instrument may give them different readings, and I think the same applies to oximeters. Now, if you have your own oximeter, of course, you have your own readings and you are able to know your general condition. For those using oximeter, many of them have respiratory problems such as asthma and also pulmonary problems. So they do know that when their reading is at a certain level, they should see a doctor. And they don't have to worry too much if the readings returned by their own oximeter and the oximeter in the kit are different. So there is also a hotline. We are giving out an oximeter in our anti-epidemic kit so that if you are isolated at home, you still have ways and means to monitor your own conditions. And if you have any queries, you should call our HA hotline, and we will have someone to give you advice. If to a certain extent you cannot obtain assistance on the phone, then you can make an appointment at our designated clinic so that you can understand how to use an oximeter and also points to note. So members of the public don't have to worry too much about the instruments. We have procurement procedures and we follow our usual workflow. Thank you. Dr. Lau. We have consulted experts at HA and also universities in the administration of the new oral drugs. For instance, the patients that's that should be prescribed with the drugs and the indications and contraindications, all the clinical guidelines are already for every doctor to see. Besides, a doctor should know the characteristics, the contraindications, and indications of a drug before prescribing it to a patient. And we've also considered various references, such as guidelines from manufacturers and also report from studies. I think members of the public should tell everything about yourself to your doctors, medication you are taking, your medical history, etc. And then the doctor will decide on whether you should be administered with the new oral drug, and if so, which type, with such information. Asia World Expo is only part of the facilities for treating COVID patients. As mentioned by the Secretary for Food and Health, we use a triage system with different tiers of treatment depending on the condition of the patient concerned. Now, for for the highest tier for serious cases, perhaps our ICU for the mild cases, perhaps hospitalization in our internal medicine ward, and if the case is really rather mild, then perhaps our AWE isolation treatment center or even community isolation facilities, or to wait at home pending admission to CIF.
嘅儀器係唔一樣啦。
Each facility has different equipment. For instance, in an ICU, respirators might be available. Those might not be available at the AWE. So we would assess the needs of different patients and arrange them into different facilities for proper treatment. Next question, please. I'm from News. I have 3 questions. First of all, manpower at residential care homes for the elderly have been tight. Of the 2,000 staff, only 20 were trained. But due to the pandemic in Shenzhen, many found it hard to come to Hong Kong. What plans do the government have to overcome this issue? Second question, since the 5th wave of the pandemic started, there were many positive cases of patients who were infected again after testing negative or after recovery. And so is there a likelihood that people could test positive again a long time after recovery? The public hospitals are saturated, so some people would seek medical attention at private hospitals. Some patients found that certain private hospitals providing round-the-clock general outpatient services suspended service or are only providing limited service. What is the reason for that? And what is the what is the HA's take on this? We'll talk about the collaboration between the government and private hospitals, and finally I will address the question on the manpower position at RCHEs. Normally, 3 months after recovery, the likelihood of a reinfection is relatively low. Since the 5th wave started, about 500 cases have been infected during the 1st to 4th wave. Like I said, we are now collaborating more closely with private hospitals by introducing more beds or the types of patients transferred. Initially, only non-COVID-19 patients were transferred to hospitals, and now some COVID patients have been transferred. For private hospitals who suspend certain services due to different reasons, and if the patients had to be returned to public hospitals, we would do our best to take care of the needy patients. Where possible, I believe private hospitals would resume their services, including patients with urgent needs or COVID patients. I see that these patients are attended to by private hospital clinics. In terms of the manpower position at residential care homes, healthcare and care staff are lacking. That is why we are constantly monitoring the manpower position. The mainland staff are offering help in Hong Kong, and the second solution is to recruit more manpower in Hong Kong. We understand that they face a certain degree of pressure. We have introduced isolation measures so that we can shorten the quarantine period and allow staff to resume work earlier, and this would help relieve the strain on manpower. Next question, please. The reporter on the front row, please. from TVB. For the RAT declaration system, we received reports that some people could not download the isolation order after filling in the particulars, and as such, they could not apply for sick leave. And at the Department of Health's website, many people left comments citing such difficulties, but there were no replies and they could not reach the hotline. Did you receive relevant complaints, and what is your recommendation for these people? As for the situation at AWE, you talked about the diversion of patients to different facilities. We saw 2 deaths in which patients were in serious condition and they were still transferred to AWE. Was it a mistake in transferring these patients? The AWE lacked manpower and many patients lacked support, and there was a lack of support to help some patients use the toilet. After the mainland delegation arrived in Hong Kong for the facilities at AWE that are yet to be commenced, would they be open for use? Some private hospitals commenced some COVID clinics, but these hospitals were not given oral drugs, and would such costs be recovered from private hospitals? I would first answer the question on the declaration system. From the 26th of February to 5th of March, there were 180,000 successful applications and isolation orders were issued. So far, we see that the platform has functioned normally. We understand that some people ran into difficulties, and we found earlier that for those who use certain phone models, they had difficulties downloading the isolation order. We improved the situation immediately to allow everyone to download isolation orders. We also received complaints that they could not download the isolation order on their smartphones, but they could download the file on their computer. So this was a compatibility problem. If for those who had difficulties downloading the isolation order, they could get in touch with us. We are providing a special 24-hour hotline. Callers can enter their isolation numbers and phone numbers. The number is 1-833-6119. This is a computerized 24-hour hotline. After a declaration is made, we would issue an SMS message containing a link. And after clicking on the link, the applicant would have to upload their Hong Kong identity card copy and RT test photo. But the link is time limited. After receiving the SMS message, the link must be used within 24 hours. We do not want to see situations in no documents are uploaded a long time after a declaration is made. And if that's the case, we might need to deploy contractors to verify the information face to face, and that would lead to a delay in reporting. That's why we ask members of the public to upload the information immediately after receiving the message. They simply have to upload a photo of their Hong Kong identity card and RAT result. And if these are done, the isolation order could be downloaded. But if due to different technical issues such as the smartphone or computer model, if there are issues, they can get in touch with us right away.
There are different departments operating different facilities to look after children. As far as the HA is concerned, we have host number 8, 9, 10, and 11. You may recall that in previous waves, we have different halls to receive confirmed COVID patients. Back then, they were for younger patients with mild symptoms. The facilities were there for isolation and some treatment. But with the fifth wave, we have more and more senior patients with chronic illnesses, and many are bedbound that requires long-term care. If we don't transfer them to Asia World Expo, then the pressure on hospitals will be rather high. And for the 3 patients I mentioned, they were not being taken care of in our halls, but by SWD. As regards their details, I don't have them now, and I can't ascertain with the SWD now. Now for our halls, indeed, patients there are more serious. Many of them are bedbound. They require more care, and therefore they need more manpower. Previously, we had 1,000 beds, but we have only admitted a few hundred patients because we have to focus our nursing and medical staff to take care of this group of elderly patients that require more care. With the visiting mainland medical teams in Hong Kong, we are confident that our ability will be greatly boosted with more manpower and capacity, and more beds can be opened in Asia World Expo to take care of patients. When it comes to private hospitals, we have an established mechanism to borrow drugs to private hospitals for treating patients. Of course, we will take into account a number of factors. For instance, whether private hospitals have channels to procure such drugs, patients' indications, and also our inventory. We have such a mechanism between us and private hospitals. They know how to invoke that mechanism, and patients needed, we will discuss with private hospitals how to give the most suitable treatment to patients. 2 more questions.
A few questions from the SCMP. So, in terms of the beaches closure, how risky is the transmission of COVID-19 in beaches, which are open-air environments? Is the closure of all government beaches justified from a scientific point of view? And for HA, how many patients have been prescribed with Paxlovid today? The last question is, it's reported that the patients recover from COVID are unable to obtain vaccine exemption proof from both government and private clinics, so they're unable to enter premises listed under vaccine pass. Will the government set up other channels for these people to obtain exemption proof? Thank you.
Okay, so maybe I'll ask Dr. Lau to respond to the question of HA, and then I'll respond to the social distancing measures for the outdoors activities and also the vaccine pass issue.
For the drug of the used for the past few days, there are more than 1,000 patients has been taking this kind of drug. I mean the oral antiviral drug for the COVID-19. For another drug which is produced by the Pfizer, it has been started to be used from today. So I still have no statistics of how many patients has been prescribed. The drug has been used in different places, including the hospital, the designated clinic, as well as in the OH home. Our doctors will prescribe the drug to the patients according to the clinical symptoms, the different criteria, as well as the patient's characteristics.
Okay, so for the social distancing measures during this the fifth wave. Especially now we have about 30,000 cases a day. So our current measures is to to enhance our stringent social distancing measures, especially when there are gatherings and indoors and both outdoors. So because there will be some gatherings and also the mass-off activities, so we'll still request for such a stringent measures, especially for the outdoors like beaches. So for the vaccine pass issue, indeed, for those who are infected, you can assume he has received one dose of vaccines. So for the current vaccine pass, so we'll allow those who had infected will have a certain period of exemption so that they can be allowed to go to the vaccine pass venues. So the main issue is that if a person is infected, so we appeal to members of public to report if they are having the RAT, to report to the RAT platform so that they can get the documentations to facilitate them to present to the venues so that just like they have a shot of vaccinations. So for this RAT platform, the any applicant will have a automatic generated the isolation orders. For those who are tested via the PCR, the nucleic acid platform, we will start to generate the isolation orders to those having the positive tests subsequently. So I think in the near future, any patients who has tested positive via the PCR platform, they will receive an SMS with a encrypted isolation orders so that they can present these orders to those venues having the vaccine pass restrictions.
最後一條後邊白色衫嗰位男士。
兩 AM730，先問個快屋測試嗰度，頭先提到
AM 730, it's said that some RAT positive reported cases were tested with PCR and they were found negative. And you said that, and according to instructions of RAT kits, a rather blur line is also regarded as a positive case. So how can the public tell whether they should report themselves or not? And then for people who do not know whether they were previously infected and they take as another dose, would there be any impact when it comes to the level of antigens they have in their body or antibodies they have in the body? And for the 200 beds for reverse isolation, what are the priorities? Are you talking about care homes that have never had any case? And if among the 200 there are infection cases, then how many will have to be moved away? And for mainland medical teams, since they're exempted from registration, they do not have a personal liability. Apart from stressing that they are experts and we should be grateful to them, what other ways and means can you ensure that the public have confidence in them? I'll first explain about vaccination and some of the random sampling of RAT positive cases report to us. Now, in March, we have done some sampling. So far, we have about 30 cases tested negative. Though they gave us a RAT positive report, we haven't completed the investigation of all cases. We are waiting for a second sample to see whether it is negative or positive. We do understand that for some of the cases, members of the public might have misinterpreted their own RAT result, and then we would readjust the numbers. Now, when we used PCR tests, there were cases that were subsequently tested negative in hospitals. So we have, in the past, readjusted the case numbers. Different products have their own instructions. It is hard to tell what two blur lines mean. Now, for a blur line. The instructions will say very clearly that it is an invalid test and the person can do another RAT. And if in such a case, we will not prosecute because we can see very clearly from the uploaded image. And if we do not see any deliberate misreporting or coverage, then we will just end the isolation hotel order, and different cases will have different handling.
大家都睇到我哋科學委員會
In terms of vaccination, the Joint Scientific Committee has offered updated information. In the past, according to the Joint Scientific Committee, for those who were infected, they recommended the next dose after about 6 months. The recommendation was based on how the benefits of vaccination could be maximized. According to a lot of data, the JSC was of the view that the interval between vaccinations could be shortened. So for those who were infected for the first time and unvaccinated, the recommendation was to receive the first dose after 3 months. So the first infection was akin to the first dose of vaccine, so that was the logic. It was not related to the potential dangers of the vaccine. So it was about maximizing the benefit of vaccination. Different countries had different views on when the first shot should be administered after the first infection. Some countries recommended the first dose after the symptoms disappeared after an infection, so it could be as short as 1 or 2 weeks. So the emphasis was on providing protection. At RCHEs, whenever there is a major outbreak, after a patient recovered, we recommended the first dose after 4 weeks. Many Omicron patients were asymptomatic. They didn't even know whether they were infected, and many of them were not tested. So there is no need to be too worried about vaccination just because they did not know whether they were infected. Vaccination is certainly of benefit, but for people who were unsure whether they were infected before and those who were not subject to tests, they could receive the first dose on their own accord. The benefits would certainly outweigh any potential negatives. If you tested positive, please declare the result through the system. The isolation order generated could facilitate registration in our system. We are concerned about the vulnerable groups, such as unvaccinated people above the age of 60, and also pregnant women or children who are unvaccinated. Once they declare their results on our system, our patient support call center could get in touch with these patients, and the patients could be arranged treatment at designated clinics. And where possible, the high-risk individuals would be transferred to our hospitals or isolation facilities. So declaring the positive results online is certainly of benefit. For those who will be vaccinated later, our staff would be able to see when they were infected and when they should receive the next dose, and this would also facilitate the vaccine pass. So there's no need to be too concerned about potential negative effects of vaccination. Dr. Lau? We understand there's interest on the approach used by the mainland medical support team in Hong Kong. Once again, we stress that we adopt a collaborative approach as to how we work with the mainland medical staff. We are deploying different methods. They would have relevant background and expertise, and they were relatively experienced doctors or nurses in their respective specialties, and they came from leading hospitals. There's an assessment mechanism for hospitals in Hong Kong. Some of them might come from, let's say, AAA hospitals. So we could see that the medical team that arrived in Hong Kong were of great proficiency. They were elite healthcare professionals in the mainland, so the public could be reassured. Hong Kong is fortunate to receive support from these elite healthcare professionals, and they can help care for COVID-19 patients. In terms of reverse isolation, and other facilities are being provided for our elderly people. Once details are available, they will be shared. We have a number of facilities that are running, and the use of different facilities might constantly change. They might be isolation facilities in the past. Initially at the AWE, there were quarantine facilities, but with more and more students or patients, they were converted to isolation facilities. In recent weeks, we identified different facilities such as community centers for other purposes, and they were put into different uses. In any facility, if we see infectious patients, they must be transferred away. So that was the main thinking. This is the end of the press briefing. Thank you very much.